lecture, and educating the public is not only to give the education, but it is to tell about our medicine and how naturopathic medicine is different. And because a lot of people, what they're used to with conventional medicine, the mainstream medicine out there, is just symptom suppression. And a lot of things she talked about, anxiety, depression, being unable to sleep, and fatigue, those are not really addressed adequately with conventional medicine because it's just covering up the symptoms. And what we're doing as naturopathic physicians is we're getting to the underlying cause. Why does somebody have anxiety? Why does somebody have depression? Why can't somebody sleep? Some of those reasons, those underlying causes, can be hormonal imbalances and excessive toxins, like she was talking about with the botanicals that help with liver detoxification. So chronic fatigue and stress is very prevalent. So how do we discover that underlying cause? How can we discover what's going on and what the problem is? We will do functional lab testing. With functional lab testing, it's different than the conventional mainstream testing that's done because conventional testing will be very black and white. We'll use that testing as well, but we use functional medicine in addition to that because functional medicine shows us how your body is functioning, especially before there is a major problem. Somebody will get a blood test done to see if they have an autoimmune disease, to see if they have cancer, to see if they have anemia. But that's very black and white. You either have a disease or you don't. Functional medicine is kind of in the gray area. It's in the middle. It's how is your body functioning at the cellular level to see what's causing those problems, like fatigue. Why are you tired all the time? Well, we can find out with functional lab testing the reason why you're tired all the time. Why do you have high levels of stress? Why do you have depression? Why do you have anxiety? Why can't you sleep very well? And that can either be done through a simple urine test or through blood. We can test for things such as nutritional deficiencies, toxic elements, and your levels of oxidative stress. Very, very useful at pinpointing the underlying cause of someone's symptoms, and it guides our specific treatment with the botanicals, with the nutrition of what each individual needs. I'll give a handout to you. This is for a patient that I had who had almost 3 decades of chronic fatigue and could not get to what was causing this. Had all kinds of tests done. Those conventional tests that I was talking about, had these tests ran, nothing was found out of what was going on, what was causing this chronic fatigue. Whether it was blood, certain imaging. Every time she was told, we can't find out what's going on, we can't find out what's going on. And you can see on here, if you look at where the levels are, the findings, where it says very low, and very high. Well, those are neurotransmitter metabolism markers. Also above that, you can see 1, 2, 3 places above that, you'll see energy production markers. So for this patient who had chronic fatigue her whole life, for almost 3 decades, well, what was it due to? And until we run a functional lab test, we don't know, we're guessing. What is she deficient in? What does she need? What is she depleted in? For her, it was not energy production markers, it was the level of her neurotransmitters at the level of the adrenal glands. We knew exactly where this patient needed support. And you can see it was a 37-year-old female, 22 years of extreme fatigue. After running the functional lab test and repleting those deficiencies, 1 week later, her fatigue was virtually eliminated and her stress was greatly reduced. And the reason for that is because we got to the underlying cause, what was causing this fatigue. That is the power of functional lab tests.